Delegation by Irene Ishen. So when we talk about delegation, delegation simply means transferring to a competent individual the authority to perform a selected nursing task in a selected situation. And during the delegation, the person delegating the task still retains accountability of the task outcome. And delegation is a skill we all learn through nursing school and on the job. But sometimes in our practice, it becomes a little bit difficult to do it because you may see the person as old, too old, or someone you don't feel competent enough to delegate a task to. Rights, 5 rights of delegation. So with the 5 rights of delegation, we have the right task. So the right task is the task being delegated legally and ethically in the person's scope of practice. The second one is the right circumstance. Are the circumstances right for the delegated task? Is the patient stable? Is the patient unstable? The right person. Is the right person to be delegated a task to? Is it the right person to delegate a task to? Is it going to be a UPA or a LPN? And is it within their scope of practice with the right direction? Does the delegate have the appropriate directions or communications to be given? So here you have to tell the person you are delegating the task to exactly what you want it done and what they should report back to you. And the right supervision is you must provide the person anything they need, like telling them what they need to do and keeping an eye on them, because you still hold accountable for the outcome of the task. Know the scope of practice of the individual you are delegating the task to. So you should know your scope of practice for your UPA or your CNAs, your scope of practice for your LPNs and your RNs. You should know that the tasks you can delegate to each individual, and you should also check with your state mandated scope of practice to know which is within their scope of practice and which is not within their scope of practice. Some people may ask, why do we delegate? Delegation allows nurses to focus on more challenging tasks. So while the nurse focuses on the IV antibiotics and the more complicated tasks, he or she can delegate the vital signs to the UPA and give him or her the parameters they should report back to her. So it creates a strong working relations within the teamwork. It also improves patient satisfaction. So whilst improving with the improvement of patient satisfaction, the nurse allows the UPA to also get access to the patient and give them the simple things they need, like getting their vital signs, helping them to the bathroom, and all that. The patient wouldn't have to wait for like 30 minutes or an hour for the nurse to get to them. And it also builds the skills of delegations. Some nurses find it difficult to delegate. So as we keep on delegating, you know what you can delegate to one individual or one team member, or what you cannot delegate to the team member. So this is all about delegation. And if you want to learn more, these two are good resources to help you with it. Thank you.